Good evening, guys, and welcome back. Dr. Shreya, Dr. Molly, and I are here presenting you with part 2 in our stress series. So this is our way of reaching out to our community of people, checking in on a time of heightened stress, giving you some resources and information that you can then take and implement into your own lives to make sure that you are well taken care of at this time. So if you guys missed our first video all about stress and hormones, that is part 1 to this continuation this evening, where we'll be giving you solutions on how to manage that stress. So we're going to dive into the importance of adaptogenic herbs and nutrients that you can use to support your adrenal glands. We'll be talking about the important lifestyle changes that need to be implemented right now for you to keep stress management as a priority, as well as the importance of blood sugar regulation. We hope you guys enjoy. Thank you so much for following along, and we welcome your questions as always. So, to start off, let's dive into the 3 stages of the stress response. So anytime our body perceives stress, our hypothalamic pituitary adrenal axis, or the HPA axis, that is responsible for responding to stress, and it's important to support it at each of its 3 stages. So the 3 stages that it goes through are stage 1, the alarm phase, when the axis responds to any acute stress in a big way. So this is when we'll see patients that may seem very high strung, anxious, or agitated if they had a big stressor happen recently in their life. They may also have stomach issues. So we see some GI symptoms start to crop up. The nervous stomach, if you experience that, then you know exactly what I'm talking about. They might have a quicker resting pulse, trouble sleeping. So this is the beginning phase of any stress response. Phase 2 is when our body starts to adapt, hence the adaptation phase. So this is where the initial activation of that HPA axis is sustained, and this will start to cause more intense fatigue, feelings of stress, anxiety, irritability, depression. Sleep issues will certainly develop. Immunity in the digestive tract will also be altered, and this gives further rise to inflammatory bowel syndrome. We can get some autoimmunity, joint and muscle pain. And in this phase, a weakened immune system is also likely. Stage 3 is known as the exhaustion phase. So this is when things start to move chronic or long-term. And this presents with more exaggerated symptoms. So extreme fatigue. Individuals are likely to present with chronic disease, pain, allergies, slow wound healing. So let's talk about how we can support ourselves at each of these 3 stages. So during our phase 1 or alarm phase, here are some not only adaptogenic herbs, but other nutrients that are important to support your adrenal glands at that time. So here we want to implement things that are actually going to calm down your HPA axis in that acute phase activation so that we can balance out the cortisol levels. So we have ashwagandha, which is an adaptogenic herb. Adaptogenic herbs help to support your adrenal glands. L-theanine, lavender oil, phosphatidylserine. There are many others as well. These are just some of my most commonly used ones. Dr. Shreya and Molly, what do you guys think?
I love ashwagandha and that whole list. Ashwagandha is definitely a great herb.
Yeah, I love it too.
There's so many ways to use these herbs too. So lavender actually just sprayed before bed, so used as aromatherapy for pregnant women, has been found to bring down stress levels. So, you know, it doesn't have to be taken orally. There's a lot of different ways to incorporate these into your life. L-theanine, you can get it through green tea.
That's right.
Matcha is a really nice concentrated version of it. So you could switch out your coffee for matcha tea in the morning, and you'll be getting your L-theanine to help you adapt to stress, as well as a smaller caffeine boost.
Love that. And when we move on to our adaptation phase, so this is where more of our heavy hitters, our adaptogenic herbs really come into play here, because we want to make sure we're really supporting and maximizing on a healthy response to stress in order to restore balance. So once again, we see our lovely ashwagandha, holy basil, I am loving right now, maca, rhodiola, eleuthero. So these are some of my favorite herbs that I use in my toolkit when I'm identifying that a patient is in that phase 2 or more adaptive phase of their stress response, and we can see great improvements when we start to support them with these herbs. Then the exhaustion phase. So this is where whenever we have more long-term effects of stress and more long-term effects on our adrenal glands, our nutrients, some of our key nutrients are readily depleted when we're going through prolonged periods of severe and quite overwhelming stress. So licorice root is a great one to add in here, which is a nice adaptogenic herb, but we also need to be supporting those key nutrients that are depleted. So vitamins B2, B5, B6, and vitamin C are super important. So one of the ways that we can also do this is through intravenous therapy. So you might see that some naturopathic clinics offer an adrenal support intravenous bag that would have your B vitamins, high dose vitamin C in there. That really helps to get your adrenal glands nice and supported.
That's great. I'll just add a quick thing with licorice. If you have high blood pressure, it's not the one for you.
Yes. Thank you for that disclaimer, Dr. Shreya. And that further, it emphasizes the importance of working with a trusted healthcare provider, especially naturopaths. I know we're biased by saying that, but we truly do have the tools and the assessment resources available to help figure out your best approach and how to support you in the best way.
And the dose of each of these is going to be very much dependent on who you are.
That's right. All right.
Awesome.
All right. So this is some fun stuff that helps you manage your stress. So some of the things I'm going to talk about in more detail are exercise, gratitude, nutrition, meditation, sun exposure, and quality sleep. I would recommend anyone watching this video to pick one of these items and put them into your lifestyle now. We're all in an increased stress response, and just doing one can have profound impacts on your health. So thanks. Just one quick thing I wanted to mention about exercise. There is a sweet spot you need to be at. So yin yoga is really good for someone in that exhaustion phase that Mary Ellen, Dr. Tedeschi mentioned. But I do notice that any patients who are athletes, they can be at high risk of adrenal burnout. They can be at high risk of needing additional adrenal support. Exercise can put you into a chronic stress response if you do it extensively every single day. So there's a sweet spot for each person. You can change slide.
Awesome.
All right. So meditation, there's a lot of studies on meditation. It's been found to improve the immune system, so your resilience to bacteria and viruses in our environment. It can decrease heart risk factors, so it can help lower blood pressure. Transcendental meditation, for example, has been found to lower blood pressure by as much as 10 millimeters of mercury. And so that puts it equivalent to some of the drugs out there. But it's important that, if you work with someone who knows exactly the impact that any one of these interventions will have, so that you stay on track. As always, don't change any of your medications without consulting a physician. And if you're trying to manage that cortisol stress response, meditation is a really good tool to add in. A good way to add it to your lifestyle is to associate it with a daily cue. So think about your day, think about a time when you can sneak in, even if it's 10 minutes, add that in. So for me, I like to use right before bedtime, adding in meditation. Cortisol levels come down using meditation, and allows something called melatonin to have a greater effect on me and put me into a deeper sleep.
Awesome.
Do you guys want to add anything?
I think you covered it great.
That's great.
Just got, yeah.
There we go.
Oops. Sorry, it was frozen on my screen.
Okay.
There, we're here, right?
We're good.
Yeah, perfect. So the best thing you can do is take a look at that dawn sunlight and actually have it go onto your eyes. That's been found very effective for helping regulate your adrenal hormones across the day. The bigger issue in our society is that we have this increased exposure to artificial light, and that is associated with throwing off your cortisol, melatonin secretion. And they've observed that throwing off to your biological rhythms in body temperature and actual hormone output. So the more you can do to regulate your exposure to light, the better. So a great way to bring down that artificial light exposure, and especially blue light, so that's important to be doing at night. A great way to do that is to just stop using your screens after 7 p.m. at night. That is the best thing you can do. If that's not an option for you, you can get some of these apps. So for your laptop, I use the app Flux. It's free, and it changes my screen so that it looks more red at night, but it helps my body continue to produce the melatonin that it needs to. And research has found that using apps like this is effective in boosting your natural hormones. Mm-hmm. And melatonin, we've discussed it before, but it's what your body needs to go into good sleep. And it's also a very powerful antioxidant, and it has been found very helpful for treating viruses as well. So you do want to have great melatonin levels. Melatonin levels will decline as you age. So staying on top of these activities, regulating your light exposure, is especially important as you age.
I also love to tell my patients about blue light blocking glasses.
Yes.
So,
those have some good evidence behind them too.
Yeah, so you can even layer that on top of some of those apps that Dr. Shreya mentioned, and try on a new fun pair of glasses to wear starting at 7 to 8 p.m., that sweet spot.
Yes, they have a little tint to them. They can appear green or yellow, but they help you filter out the specific rays that throw off your hormone production.
That's right.
All right, so I digged into the research, and these are all the lifestyle habits that have evidence behind them at helping you with your stress response. So please make some time for some of these. It's going to help you feel great. It's going to help you think clearly, and just those benefits just help you be more productive in general. If you're coming from a centered space, you're less likely to spend your time doing things that aren't good for you. So one of my favorite things to do is dance as a workout. So Zumba, for example, is a great stress management technique, but it's going to be very person and patient specific what resonates with you. But yeah, each of these is something that's effective. Even looking at something beautiful. So if you go outside, you see the flowers, take a moment, smell the flowers. You're helping your stress response. So in art, there's a nice article on that, and people going to art museums and having an improved stress response. What are some of your favorites, guys?
Well, I was actually going to brag about your beautiful painting skills too, Dr. Shreya.
Well, thank you so much. Almost wish I did more, but I do love painting.
Yeah, and I honestly love music. I love looking at beautiful things. I have an appreciation for art too. And one thing that's really helped me through this time is gratitude journaling. So even something as simple as before I go to bed, I write down one thing that I'm so grateful for, one unique thing that I'm grateful for each day. And it's really been helpful.
Yeah, we have some great studies on the power of gratitude. And, in our booklet that we'll be putting out after this call, we're going to include that. There's going to be a gratitude journal in there so people can get started. So what Mary Ellen is mentioning is that you just every day you pick a time to think about the things that you feel grateful for, and it helps rewire your brain in these positive feedback loops. So it really helps shift the way you think away from this chronic stress response.
Mm-hmm. Awesome.
All right.
Is it frozen?
Yeah, it's a little frozen.
Oh, there we go. We're back.
Okay.
Just one last, so these are all conditions that meditation, relaxation is helpful for. So if you have any one of these conditions, please take adding some stress management techniques to your life seriously. It can really improve your quality of life. And we have the data to back it.
Awesome.
Thanks, Dr. Shreya. Yeah, so the next topic is blood sugar regulation. So to set the stage, I just want to review the main mechanism behind blood sugar regulation. So if you look at the picture that's up on the screen right now, you'll notice some of our major signaling hormones, and that's insulin, leptin, and cortisol. Insulin gets released as a response to elevated blood sugar. So that's, for example, after you eat a meal. Its job is going to be to take the sugar in your blood and put it into our cells. Thus, in a healthy response to a meal, we'll see this insulin rise and fall over an appropriate amount of time. And a key thing that I like to point out about insulin is that whenever insulin is elevated, we're in fat storing mode. So it's going to be really hard to break down any fat or lose any fat as long as our insulin's elevated. The next one is leptin. So this guy I like to call your fat stat hormone. That's because it's being released from your fat cells and telling your brain how much fat you have, and if you need to increase or decrease your appetite. And then finally, which is kind of the star of this webinar, is the cortisol, which, as you all know by now, is our stress hormone. And so when that gets released, you will see that it will also increase your blood glucose. Thus, it's going to increase that insulin and put you back into that fat storing mode, which is why we sometimes see that weight gain, as we talked about last week with stress response. So if we go into the next slide, thank you, we can look at all the factors that can alter that optimal functioning of a healthy blood sugar response. So this includes circadian rhythm, which Dr. Shreya talked about, regulating that blue light, late night, genetics, light exposure, eating patterns can all tamper with that. Sleep, which we've also discussed. A fact that I like to share with people is that even after just a few nights of decreased sleep, we get a 40% decrease in our glucose response. So if we translate that, that means that eating a bar with, say, 20 grams of sugar, your body's going to react as if it just ate 28 grams of sugar, which nobody wants. So then we move on to stress. Again, stress can be more than just that mental emotional picture. It can also be that infection, dysbiosis, possibly some genetic SNPs in there. And then we get into the world of gut health and hormones. So the literature is in support that alterations in a healthy gut microbiome can occur from yo-yo dieting, nutrient deficiencies, food sensitivities, diets like the keto diet, and then birth control use and antibiotic use. All of these things are going to alter major gut hormones, and thus that's going to result in major alterations in the signaling that we get from them. And then finally, which we discussed briefly, was that insulin response, and that's usually caused by poor diet. So on to the next slide. We're going to start looking at some solutions to each of these steps.
Sorry, just bear with me.
It's okay.
Yeah, it's something the keto diet, especially in women, can impact our stress response much more differently from men. A lot of the studies on diets in the past are based on a male population.
That's a great point.
Yeah, and there's definitely ways that you can implement more of a keto diet to a female, and that includes things like matching it with her cycle. So maybe it's not doing keto for the whole month, but doing keto a couple of weeks and then taking a break and letting our hormones fluctuate as we need them to. So sleep, stress, circadian rhythm, Dr. Marilyn and Shreya talked about those. So we'll kind of dive into the diet. So when we look into diet and blood sugar regulation, we can look at things like optimizing the time of eating and how we're pairing our macros. So many of you have likely heard of intermittent fasting. It's pretty popular right now. Lots of people practice it. Lots of people see good results from it. It's basically a way to increase our time spent in a fasted state where that insulin is going to be low and allow for fat breakdown and cellular repair and all that good stuff versus the fed state. And then there's another diet called the FID diet, which is the food insulin demand diet. And that has really great research supporting its ability to regulate our glucose and insulin response. And then when we look at macros, which is our protein, fat, and carbs, that can get a little bit more complicated just because our genetics play a big role in how we're going to respond to each of those. But as a general rule, a good place to start is making sure when you're having carbs, you're pairing it with protein, and that's going to allow our blood sugar after we eat to be more balanced. So if we go on to the next slide. we're going to talk about gut health a bit. So of course we can use testing. So the GI Maps test is going to allow us to look at our gut microbiome and see if there's any kind of chronic infections that is causing our blood sugar to look kind of wonky, or to cause stress on our body. But usually this will be a gut healing protocol. So in addition to a diet that's fit for you, we're going to look at implementing probiotics, prebiotics, and maybe some mucus lining support. And if needed, addressing, some LPS, which is an endotoxin given off by gram-negative bacteria in our guts. And then I want to talk about just a few supplements that are kind of my go-tos for blood sugar specifically. The first one's inositol, and that one is shown to control cravings. It can lower HbA1c, help with energy also. And then we have gymnema, which is an herb, and this is shown to reduce that blood glucose after you eat. It can help with maintaining a healthy BMI, and it also can help with decreasing HbA1c. It can improve your cholesterol panel, and it's also an antioxidant. So any kind of oxidative stress you're dealing with, gymnema is going to help address that. And then chromium is shown to improve insulin binding and also lower that HbA1c. And then I always like to talk to my patients about apple cider vinegar. The studies on it are just pretty cool, and it's a really cheap and easy way to implement something to help with your blood sugar into your day-to-day life. So on the next slide, it's just a compilation of all the studies around, there it is, around using apple cider vinegar before a meal. So the one that I always use as an example is that one on the right. So in this study, they basically had a group of people. It was done in China. They divided that group into two groups. One group got 2 tablespoons of apple cider vinegar before eating a cup of white rice, and the other group did not get the 2 tablespoons of apple cider vinegar. And the group that took the apple cider vinegar showed a 40% decrease in glycemic index from the white rice. So that's huge, and such a cheap and easy thing to implement. And just one note on that, if you try that and you get a lot of burning, that's a good indication that you already have too much stomach acid and we don't want to continue that therapy.
One of my favorite ways to add that in is just a couple tablespoons and an ounce of water taken as a shot before your meal so that it doesn't get to your teeth. Definitely don't want anyone drinking bottles of apple cider vinegar straight.
I was going to ask what you guys think about the apple cider vinegar gummies that are out there right now.
Oh, I didn't know about those.
No?
No, I've just seen capsules. I've never heard of gummies. That's a great, I think gummies make sense because you're getting the digestive enzymes.
Mm-hmm. Yeah. A few of my patients have tried them. I haven't tried them yet though.
Yeah. I've also heard people adding like a little bit of lemon into it. Takes away the strong taste of the vinegar a little bit. Yeah. Some people don't mind the taste as much as others, but yeah.
Awesome. Thank you guys so much for sharing, Dr. Molly and Dr. Shreya. So these are a repeat of our slides, information on how to reach us, the same ones that were on our presentation last week. So I'll just go through them again. And if you want more information about how to find us, we'll be posting this in our YouTube videos. Also, we are putting together, let me just stop the screen share for a sec so you can see us. Oops. Just a sec here. There we go. So we wanted to let you guys know that we are putting together a PDF, so an ebook summarizing last week's topic, so stress and our hormones, and giving you the information about all of these great solutions we talked about tonight. Yeah, so keep an eye out for that. We'll be posting that on our socials on how you can get your hands on it and continue this great conversation.
Yeah, and reach out to us. Let us know about what you want to hear about next. Send us your questions.
Yeah,
we're open to all sorts of topics. We actually don't even have our one chosen for next week. So
yeah, so we're open to it. All right, thanks so much for joining us, guys. We'll talk to you soon. Bye. Bye.